Access Minnesota. Issues that matter to you. Access Minnesota brings you the newsmakers and the stories that shape our everyday lives, with analysis from University of Minnesota faculty experts.
Welcome to Access Minnesota. Coming up later on in the show, we'll look back at the 40-year history of the University of Minnesota's Department of African American and African Studies. We'll also learn about some fun winter activities in Minnesota. But first, Minnesota is home to a growing number of residents for whom English is not their native language. Communicating with non-English speakers is especially critical in times of emergency. Joining us is Lillian McDonald, Executive Director of ECHO Minnesota. Lillian, welcome to Access Minnesota.
My pleasure, Jim. Thanks for having me on the program.
First of all, tell us, what does the acronym ECHO stand for?
That stands for Emergency, Community, and Health Outreach, ECHO Minnesota. We were born in 2004, an idea from local and state health agencies who got together with some post-9/11 funding to solve a problem, and that is, if there is a pandemic influenza, for instance, a huge health crisis, how will we communicate to families who don't speak English at home? And we put an idea together, the project called ECHO, and we use mass media and partnerships to reach those communities across our state.
And what is ECHO's mission?
Well, our mission is to provide educational and emergency information in health, safety, emergency, and civic education topics. It's really all about integrating people in our communities and helping them understand how to do just that. You might not know this, but recent demographic reports show that about 18,000 new residents come to Minnesota every year to fit in. And that's a lot of fitting in when you're talking about how to be healthy, how to be safe, how to get kids through school, how to find a house, how to find a job, especially in tough times, and how to learn a language.
Now, with more immigrants coming to Minnesota, I have to imagine that the need for ECHO services is growing exponentially.
It is growing. We have ballpark right now, 210, 500,000 residents that are really in need. By 2030, we expect that number to almost double. And what we're finding is, and what we found in short order, frankly, is there are major demographic groups like Spanish, Hmong, and Somali, but the groups also change as demographics change. So we have to keep up with the cultural changes. More than 100 exist in the Twin Cities alone. The school systems have been dealing with this one-to-one for a long time, but when it comes to mass communicating, like mass evacuation, mass inoculation, a tornado, I mean, that's mass information in multiple languages. That's what ECHO does, and so that's what we've been trying to do, is integrate an ongoing educational service, as well as keeping that infrastructure alive, whether it's programming on TV, web, radio, phone, or relayed through partnerships, so that it's ready in an emergency.
And Lillian, tell us about some recent emergency situations during which ECHO services played a vital role.
Well, two in 2009 that come to my mind right now are, number one, the H1N1 situation. I mean, talk about a lot of messages. Who gets the vaccine? When is it coming? If it's coming in the fall or by winter, who gets it first, second, and why? A lot of messages. How many doses and when? And flu, traditionally, peaks, and there's an ebb and a flow in flu. So information needs to be ongoing in order for it to be useful. So H1N1, we saw almost a 200% increase. We just pulled this data, actually, because we're interested in knowing how many more people are using this, but almost a 200% increase in our materials to reach limited English proficiency populations with information across a variety of tools in different languages, just on H1N1 alone. Almost as much use earlier in the year, last spring, when up in Clay County we had the flooding along the Red River. And in that case we needed new languages, Croatian and Kurdish, complemented about 7 other languages that we put on with information on flooding. So it changes based on the need, the area, and the frequency of information.
Lillian, tell us about some of the communities that ECHO serves.
Well, we're a statewide project, so all of our programs are available whether they're on public television and cable TV stations. We're working through community-based radio stations. We want to do more work with public radio stations, our website, our toll-free phone line, and then partnerships. And that's really a critical key, because if you miss a broadcast, The information is still available on our website, but what we found is our populations, because they're not used to having mass messaging, actually sit around and watch DVD copies of our programs, whether it's focus groups, clinics, ESL, English Second Language school systems, libraries, places where these cultures might meet, a mosque, a grocery store, a community center. Folks will sit around and watch the program. Senior centers will do this as well. And it's refreshing for them because they see and hear people from their own cultures who understand. Now that's probably the uniqueness of this project, and probably our biggest key, is we bring together the official information from medical, safety, and other professionals, and we combine that with the cultural information from cultural leaders. They work with us to present the information, so they know the nuances of the culture. They know the problems, the challenges. And so instead of just scratching the surface with information that maybe public officials might do, like here's the important message we want everybody to know, well, now we actually go below the surface and we say, well, why aren't people getting the foods they need? Why aren't people able to integrate into the systems fast enough? Or what are they afraid of? What are the cultures afraid of when it comes to getting inoculations, for instance?
Lillian, do you have a feel for how many people ECHO serves in a given year?
Well, in mass, it's hard to know. I mean, we're talking about a statewide project. If everybody tuned in that didn't speak English, maybe 1 million. But we do some return on investment data for folks that invest in our work. We know in the Twin Cities alone, on average, about 9,500 folks watch us. That's just in the Twin Cities. Remember, we're a statewide broadcast. Our website will average 2,000 to 5,000 viewers who actually come download and use information in a school, a clinic, or another setting. Our phone line, our numbers are up and down. It's a recorded phone line, so that depends on who drives people to the phone line. And our partnerships grow every day. So to give you a lump sum number, it's really hard to know, but we do try to keep track of information so we know who's watching when, which cultures are being served, and how can we improve that work every day.
I would imagine that ECHO welcomes donations, welcomes people who would like to volunteer with the organization. Where can people go to get more information about ECHO, how they can help, and more information about what ECHO is all about?
Well, thanks, Jim. I appreciate that question. People are interested in helping each other, especially this day and age. And that's one of the bonuses about ECHO. We started as a government project, but we are now a nonprofit organization. We shifted to that because we know the government cannot bear the expense of all the needs. Government pays about 25% of our budget. The rest comes directly from sponsorships, folks that have a message they're trying to get out to the cultures, and they work with us. We get their message out, and they can purchase that. The other thing, we take our donations from organizations that maybe serve employees. They have employees who speak multiple languages, and so they want to show their interest in supporting their employees and their families as they integrate and grow. And of course, we take individual contributions from philanthropists. And the best place to find that information is at echominnesota.org on our website.
Lillian McDonald, Executive Director of ECHO Minnesota, thanks so much for joining us on Access Minnesota.
My pleasure.
Coming up next, we commemorate the 40th anniversary of the University of Minnesota's Department of African American and African Studies.
Access Minnesota will return after these messages.
Now for today's lesson, we are going to learn how to stay healthy during flu season. Now remember, to keep those icky flu bugs away, stay home if you are feeling sick, cover your mouth if you cough or sneeze, wash your hands consistently throughout the day, and remember to get vaccinated. Do you think you can remember that?
Yes, Ms. Lee.
What was that?
Yes, Ms. Lee.
Good.
The advice may seem repetitive and, well, elementary. But this flu season, remember basic prevention. Protect yourself and others.
Can we stay for nap time?
You're watching Access Minnesota. Here's Jim Dubois.